So in today's session, we'll discuss on this small topic of mental health nutrition. If anyone is joining late, please help them out with the topic name. These topics are not from the textbook. Okay. So eating high quality food that contains a lot of vitamins and minerals and on antioxidants, it will nourish your brain, your body, and it will protect you from oxidative stress. Okay, because any any action that takes place inside your body, any chemical biochemical reactions that takes place inside your body, free radicals are produced. Okay, when a reaction takes place, there are certain waste materials. Okay, these wastes are the free radicals. Okay, this is produced when you're second. So this is produced when your body is using oxygen. So every action in your body, it requires oxygen. So you can understand at every cell, okay, at every cellular level, every cell's level, free radical is being produced. Okay, whenever the oxygen is being taken up by your cells, okay, for its function, free radicals are going to be the byproduct of it. Okay, so your brain, if it is deprived of good quality nutrition, these free radicals are also produced in your brains as well. You have neurons there, those are the cells. Okay. So neurons will be there in the brain. They require oxygen and free radicals are produced. If good quality nutrition you are not taking, the free radicals that are produced in your brain, there is nobody to, there is no antioxidants to tackle these free radicals. And slowly it begins the process of inflammatory damage to your brain cells. Okay, damaging inflammatory cells will start being produced in your brain's enclosed spaces, and further, this inflammation will trigger more bad reactions. Okay, it will lead to tissue injury, brain tissue injury, and that's how it can lead to some mental health disorders as well. Okay, so if the brain tissue undergoes any form of injury, there are some consequences to it. Okay, so how are diet and mental health linked? What is the relation between these two? Eating well can help you feel better. You don't have to make big changes in your diet. Okay, but even if you can try to incorporate some simple things like taking more antioxidants. Okay, when you follow these habits, it is much better. Okay, eat regularly because this can stop your blood sugar level from dropping. It can make, if you're not eating regularly, you will feel tired and also you will have a bad temper, mood swings. Okay, these can happen if your blood sugar levels are fluctuating. Okay, especially if your blood glucose levels are falling down, you will not have the energy to function normally. Stay hydrated. Even mild dehydration can affect your mood, energy level, and even the ability to concentrate. Okay, so stay hydrated. Eat the right balance of fats. Your brain needs healthy fats to keep working well. Okay, and they are found in seed oils like olive oil, rapeseed oil. Rapeseed oil is mustard oil. Okay, nuts, seeds, other fishes, avocados, milk, egg, they all have essential fatty acids which are good for your brain. Okay, as much as possible avoid trans fat. From where do you get trans fat? All processed and packaged food have trans fat. Okay, you take any packaged food, go and see the ingredients. In the fat section you will see saturated fat, trans fat, unsaturated fat, total fat. Okay, you will find this. Okay, after this courses and all, you will understand what is the meaning of it. Okay, so usually there are certain brands who sell zero trans fat food. Okay, no trans fat used, which means they are not using dalda, vanaspati. Okay, these things are not being used in the processing. Okay, because dalda, vanaspati, they all are also trans fat. Okay, so avoid using it. They can be very bad for your mood, your health, etc. Include more whole grains, fruits, and vegetables in your diet. They contain more amount of vitamins and minerals that your brain and body require to stay well. Okay. As much as possible, raw fruits and vegetables are much more potent in your diet, and not just for mental health, also for your gut health, for your gut microbiome. Okay. For your constipation, severe constipation. Okay. Other gut related diseases. Fiber from raw fruits and vegetables are very essential. Okay. But more than the amount of fiber that you get from fruits and vegetables, but more than that, if you start eating legumes, okay, legumes are a much better source of fiber. Okay. Include some protein with every meal that you eat, breakfast, lunch, dinner. Okay, some form of protein should be there because protein has amino acid that is used by your brain to create hormones, serotonin, dopamine. Okay, these hormones, the happy hormones that elevate your mood, is made from amino acids. Amino acids you get from protein. Okay, so if you don't eat protein, your brain does not have the essential amino acids to make these hormones. Okay, these hormones, dopamine, serotonin, okay, they all regulate your mood. Look after your gut health. Your gut can also reflect how you're feeling. Okay, it can speed up or slow down if you're stressed. Healthy food for your guts include fruits, vegetables, beans, legumes, probiotics. Okay, gut health is also related to mental health. Okay, new studies are being established regarding that. The more variety of gut microorganisms if you have, the more healthier you are. Okay, the variety of microorganisms that you have, the healthier you are. And just by having a fruit or a vegetable salad for one day or for few days, that will not create more gut microbiome. It has to be in your habit. Okay, if you are using multigrains in your food, okay, it should be a habit. Okay, one entire week you focus on ragi, one entire week you focus on jowar, one entire week take rice, one entire week take wheat. Okay, if you are cycling your pulses and cereals like this, it is more beneficial for your gut flora. Okay, to create a variety just by having uh, even if it is any probiotic drink or probiotic milk and all, just for 1 or 2 days, if you took it and you think that you have given your body enough microflora, microbiome, it's not like that. Because even if you take a glass of buttermilk, okay, more than half, 80%, 70 to 80% of the lactobacilli present in the buttermilk dies away where as soon as the buttermilk reaches your stomach. If you take a small bowl of curd, the lactobacillus in it will die away. Okay, will be killed as soon as it reaches your stomach because of hydrochloric acid. Okay, so this should be a habit. Taking probiotic should be on a daily basis. Only then your stomach would understand. Okay, so some samples of, because just for example, today you had buttermilk. Okay, 10% of lactobacillus is in your gut. Tomorrow also again another 10%. So on a daily basis, 10% if you're getting, some of them will remain back to reproduce and spread. Okay. Otherwise, when any new microbiome is being sent into your body, you're trying probiotics for the first time. Okay. A new microbiome is entering your body. First of all, it has to pass your hydrochloric acid in your stomach. The second step is it has to it has to pass the already present microbiome in your gut. They will attack it. Okay. New microbiomes that you introduce will undergo attack from your existing microbiome in your gut. Okay. It has to give you immunity. They don't know that this is a good bacteria or bad bacteria. They just know that this is something new. Okay. And they will kill it. But these things will happen. So probiotic is not something that you take just for 1 day or 2 day and think that the rest of the week I will not take. I have had probiotics twice this week. It will not work like that. Okay. On a daily basis, you have to reintroduce the same type of probiotics again and again. Okay. Is it clear to all? Be aware of how caffeine can affect your mood. Okay. It can cause sleep problems, especially if you drink it close to bedtime. Okay. And some people may find it quite irritable, and it can make people anxious also. Caffeine is associated with anxiety. Okay. So if you come across anyone who has a lot of anxiety issues, okay, or they may be diagnosed with some anxiety disorders. Anxiety disorder is also a mental health condition. Okay, they should avoid caffeine. Okay. Caffeine is found in coffee, tea, cola, energy drinks, and even in chocolates. Okay. So even if you are a regular individual, see how caffeine affects your body. Okay. Of how it affects your mood. Suddenly, just soon after having coffee, you are all cheerful. Okay. But within 1 hour, your mood switches. It goes to the other end. That is also bad. Okay. That is also bad. So caffeine kind of it mimics the way how certain happy hormones like serotonin and dopamine acts in your brain. Okay, it mimics that pathway. So that's how caffeine works. But that's why it can also be called as a mood enhancer. Coffee is called a mood enhancer. But you have to self monitor. Okay, how your body reacts. Some people, for them, it is difficult to have coffee because it causes a lot of acidity. Okay, caffeine is acidic in nature. Those who have peptic ulcer, stomach ulcers, avoid it. Okay, and don't drink it close to your bedtime. After 6 p.m., after 7 p.m., don't have coffee. Okay, because it will affect your healthy sleep pattern as well. Next is some behavioral habits like sharing meals with other people. Okay, eating meals together with other people will have some psychological and social and biological benefits. Okay. It can give you a sense of rhythm and regularity in your life. Okay. Meal time will be something you will be looking forward for. Okay. People who go to office and all, they will understand. Okay. They eagerly wait for lunchtime because that's the time they can socialize. Okay. They can meet their colleagues, talk informally. Okay. It gives them a sense of belongingness. Lunchtime, tea time breaks. Okay. These breaks are something that it is not just you are meeting your nutritional requirements, but also your mental health requirements of socializing. Okay. So share whenever you sit down to eat, make sure you sit and eat with somebody. Okay. So it also gives you a chance to reflect on the day, feel connected to others, Okay, biologically, eating in upright chairs helps with your digestion. Don't slouch over the table. Okay, even if you're using some dining table, there are some people who will bring their head towards the plate. Okay, it should not be like that. The food should come towards your mouth. The food should serve you. Okay, the food should serve you. The dining table should serve you. You are not supposed to serve your food that is bringing your mouth towards the plate. It should not be like that. Okay, because it gives you a bad posture. Okay, when you sit upright and eat food, there are less chances of acidity as well. Okay, so sit upright and make sure your spine is straight while you are having food, so that the only reason why, because when you're slouching over the table, okay, your esophagus, it contracts, and there are high chances that whatever you eat, when you're actively eating, your stomach is very active. Okay, there are high chances that hydrochloric acid can spill into your esophagus and cause acidity. Okay, heartburn. So sit upright. Talking and listening can also slow you down while you are communicating with others. Okay. Uh, Having your lunch time, but while talking with others, okay, you will focus on the conversation as well, not just on the food. So you will not like gulp down the food. Okay. You will not chow down the food. You will eat slowly. You will take your time. Okay. Your digestive juices will also get time to slowly digest what's coming. Okay. Your stomach gets time in between the conversations to digest one by one whatever morsels come in. Okay, so don't eat too fast, just to prevent you from eating too fast. If you are in a company talking and engaging and listening, it slows your eating pattern. Okay, then make most of the meal times by setting aside at least one day a week to eat with family and friends. Choose a meal that is easy to prepare so that it does not become a chore to make that food. Okay, especially when you have children or teenagers at home. At least one meal a day, everyone in that household should have like a family. Okay, and even if people have a lot, they have a busy schedule or something like that, close family members can get together at least once a week to share a meal. Okay, so when you are sharing a meal with an entire group of people or entire family, okay, whatever you prepare for that meal should be quite easy. Okay, it should not be that it took you 3 to 4 hours to cook the meal for the family and you hardly sat and enjoyed for 15 minutes. Okay, it should not be like that. Spend more time with the family, less time cooking. Okay, and even when it comes to cooking, cooking is not just the only thing. There are a lot of things before and after cooking. Okay, that's a responsibility. So don't burden whoever is the homemaker or whoever has prepared the food. Don't burden them, because that also affects their mental health. Okay, especially working women. Okay, uh, taking care of the household chores and the their official workload and all, it becomes very stressful for today's working woman. Okay, so if you are staying with a working woman, you have to share some responsibility of different tasks in kitchen as well. Okay, shopping for the vegetables or meal preps, setting the table after cooking, helping them to wash up. Okay, clean the kitchen area, clean the dining area. Okay, and switch off your smartphone, switch off your television while you're eating, because that will help you to talk and share. Okay, otherwise everyone will be focused on just one TV show that is running and there is no conversation going on. And when you eat with a series, or when your phone is on or TV is on and you're eating, you tend to overeat. Okay, you tend to overeat. But when you take away all these distractions, it slows you down. Okay, you are focused on your what portion quantity you want to eat, and it avoids overeating. Okay, is it clear to all? Next is blood sugar levels. If your blood sugar level is lower than usual, you might feel tired, irritable, or depressed. As I mentioned earlier, hypoglycemia, it affects the mood as well. Eating regularly and eating food that release energy slowly, that can steady your sugar levels. Okay. For example, complex carbohydrates. Okay. And on top of that, if you're pairing your complex carbohydrates with protein and fat, it will slow down the digestion further. Okay. So different people may have different reactions to the same food, but generally, food that releases energy more slowly, they include whole grain, bread, cereal, chapati, it is whole grain, nuts and seeds, okay, brown pasta, brown rice. Pasta also, it should be al dente, okay, it should not be overcooked pasta, okay. When you break the pasta, it should snap and break, okay, should be like that. After cooking, there should be a slight snap to the way how the pasta, boiled pasta breaks. That's al dente. So that is good. Okay, so these kind of food will control your blood glucose levels and also combine it with some protein, combine it with fiber, protein, and fat. Okay, mask the carbohydrates. Okay, always make sure that whenever you eat carbohydrates, you are masking it well so that the body has to really work out a lot to break down those carbohydrates to get sugar molecules. Okay, so that's how you can control your blood glucose levels. Then drinking fluids. If you are somebody who has been diagnosed with a mental health problem, you may not have some energy or any motivation to drink fluids. Okay. But if you become dehydrated, this can make it quite harder to concentrate or even think clearly. Okay. It's seen that a lot of mental health patients, mental health survivors, okay, they most of them are dehydrated, especially when you are in the cycle of depression. Okay, there is no motive at all to leave your bed. Okay, lack of motivation even to leave your bed. Okay, so there are a high risk of not drinking fluid, not drinking enough water. Okay, even if the water is right next to them on the bedside table, still they will not have the motivation to get up and drink it. Okay, so usually they become dehydrated. Water, coffee, tea, juices, smoothies, this all can help you feel hydrated, not just water. Okay. When we say based on your body weight, you should have this much liters of water. That water also includes tea, coffee, juices, smoothies, etc. Okay. But without sugar. Most of these contain caffeine or sugar that can also affect, make you feel different in a different way. Okay. Then fruits and vegetables. Eating different fruits and vegetables can also add a good range of nutrients to your diet. And nutrients in your diet is good for your physical and mental health. Okay, that is the basic concept of nutrition. Fresh fruit and vegetable can also be expensive or difficult to prepare. Okay, so you can opt for frozen ones, tinned, dried fruits, juiced fruits. Okay, and also vegetables, frozen vegetables, all count towards your 5 a day too, which means at least 5 types of fruits and vegetables on a daily basis, including fruits and vegetables. Okay. If you want to want a cheaper or easier alternative, you can go for the frozen ones, tinned ones, dried or juiced ones. Okay, but at least 5 different types in a day. At least 4 to 5 servings of fruits and vegetables in a day. Next, protein. Diets, so those are higher in protein, can support your mental health because protein contains chemicals which we call as amino acids. Your brain needs this to produce certain chemicals called neurotransmitters. And neurotransmitters can regulate your thoughts, your feelings. Okay. So you can find protein in different forms of food, plant-based, animal-based, whatever is your choice. Okay. Legumes are a good source of protein as well as fiber. Okay. Peas, beans, lentils, they all come under legume section. Lentils are the ones which are split. Okay, like dal, it is split. Nuts, seeds, milk, fish, egg, cheese, lean meat, soy products. Okay, these all are good sources of protein, good quality protein as well. And if you are somebody who is undergoing a mental health situation, you can't even eat properly. Loss of appetite if it is there. Okay, add more cheese to your meal, have a glass of milk, use protein powders. Okay, protein bar, energy bar, this can be your alternatives to meet your protein requirements. Next is caffeine. Caffeine is found in your tea, coffee, chocolate, cola, other energy drinks. And caffeine is a stimulant. Okay. It can stimulate, it can mimic the way how your certain neurotransmitters work. Okay. It can give you a quick burst of energy. But while it is at it, okay, it can make you feel anxious. Anxiety is more common, not depression. Anxiety related to caffeine addiction is more common. Okay. It can also disturb your sleep. So don't have caffeine before you go to sleep. And if you start to stop having caffeine or coffee, you will also see some withdrawal symptoms. Okay. You will be irritated, depressed. Okay. If you suddenly stop having it, you have to slowly taper down the coffee. Okay. First, you can reduce the strength of the coffee that you eat over a week. Okay. Then after that, switch to tea, then black tea or something which is more milder. Okay, you can go for the decaf options as well. Decaf options are available. And if you see that caffeine, the way how caffeine affects your mood, if you see that it is affecting your mental health state, okay, you can slowly reduce it. You can switch between caffeinated drink once in a while and then go for decaf on a routine basis. Okay, decaf is the decaffeinated beverage. Only the caffeine molecule is taken away, remaining the taste, texture are pretty much the same. Okay, that is the decaf version. There will be slight alteration in the taste. Decaf version, it is more like an acquired taste. Okay, if you are a regular consumer of coffee and suddenly if you have to stop taking coffee, you are switching to decaf. Okay, it is, you have to adjust to the taste. It will take you a while to adjust to the new taste. Okay, decaf, 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 decaffeinated beverage. That only the caffeine molecules has been removed from it. Okay. Instant coffee powders are also good if you are using caffeine only for its antioxidant property, because more than tea, you will not believe it, more than tea, it is coffee, black coffee without sugar, which is well researched. Okay. Years of studies have been done on caffeine, on black coffee without sugar. It's a good source of antioxidant. Okay, so caffeine has antioxidant properties as well, but it is a stimulant. Okay, so more than tea, coffee has much backed up. It is having coffee, black coffee is an evidence way, based way of adding antioxidants into your diet. Okay. Instant coffee powder is also as good. In instant coffee powders, they use this freeze drying technique. Okay. So in freeze drying technique, it's a nitrogen gas. If you know it, it can freeze. Okay. Nitrogen gas can freeze. Okay. So the same technique is used to make instant coffee. Okay. Coffee is mixed with the water. It is freeze dried. Okay. So what happens in freeze drying? When you heat something, when you heat something, you lose the nutrient value of it. But when you freeze dry them in a very high cold temperature, you are not losing the potent nutrient molecules. Okay, and instant coffees that we get these days are usually freeze dried ones. If freeze dried instant coffee powder is good, you will be getting the equal amount of antioxidants from it. Okay, there is no harm in using instant coffee powder. Green coffee is more like a marketing. Just like green tea, green coffee is also more like a marketing strategy used. Okay. Black coffee is the most evidence-based one. Okay. If you're seeking for some evidence-based supplement, black coffee without sugar. Okay. That is the best option. Then we have healthy fats. Your brain needs healthy fats, just omega 3, omega 6, to keep working well. Okay. And where do you find all these healthy fats? Nuts, seeds, avocados, flax seeds. Okay. Flax seeds, chia seeds, sesame seeds, all forms of nuts. They also have omega 6, omega 3 fatty acids. In non vegetarian sources, salmon, sardines, mackerel. Okay, salmon has the highest omega 3 fatty acid among the fishes. Any type of sesame seeds. Okay. Protein powders are safe to take. Just see if they have the proper regulations, FSSAI marked and all. Just see for it. Recently, some studies has been done that majority of the protein powders made in India are not safe. So you can see the studies. Okay, you can just check the article. Brands also, some brands they have mentioned, and all the brands that have passed the quality checks. Okay, those names are also available. So you can check that, okay, online, which brand of protein powder is safe. Ghee in black coffee, it is the bullet coffee that nowadays it was a trend. See, if you are looking for weight loss, okay, having that amount of ghee or butter in coffee is adding calories. When you're having black coffee in water, plain black coffee in water without sugar, that or with just sweetener, artificial sweetener, there is no calories at all. Okay. Ghee in black coffee, if you want to try that fad, you can try it. But remember, that much calorie is entering your body. Okay. So foods that are good for your gut health. Sometimes your gut can also reflect your mood. Okay. If you're stressed or anxious, you can feel the heartburn, your gut activity slowing down. Okay. And some people, some students, if you see when it is exam time, you try to pass a lot of motions.
Just before the exam, you feel like you want to go to the bathroom. Okay, these things happen because of anxiety. Okay? It's your body's way of coping with the anxiety, the stress of anxiety. Okay, if you are lactose intolerant, go for plant protein. If you are not lactose intolerant, go for whey protein. Okay, if lactose or milk products don't affect you, go for whey protein. Okay, if you find it difficult to manage with milk or dairy based products, avoid whey protein, go for plant protein powder. And this anxiety can also lead to problems with your digestion. You may feel bloated, constipated, okay, not hungry, or sometimes it can lead to overeating as well. When you are stressed, okay, many of the people they overeat while they are stressed. During exam time, students are really hungry. Okay, they go to the bathroom frequently. They are really hungry. Okay, they crave a lot of food during exam time. Some students they forget eating food. Okay, they forget their physical hygiene. So stress, everyone has their way of coping with stress. Okay, this is also the body's way of coping with stress. Okay, if you're feeling stressed and you think it is affecting your gut, try some relaxation technique, breathing exercise. Also try eating more food that support your healthy digestion, like fruits, vegetables, whole grains, lentils, legumes, pulses, probiotics, which has live bacteria like yogurt, tempeh, kimchi. They have live bacteria. Even fermented pickles, pickled vegetables and all, they also have live bacteria. They are good for gut health. If you are suffering from peptic ulcer, or you think if you have some spicy food and it is making it's giving you acidity, okay, when you are using green chilies, use the stalk of the green chili as well. In cooking, what we do usually, we just break the stalk of the green chilies and we throw the stalk. Okay, and we just use the flesh, the body of the green chili. To make chutneys and all, blend the green chilies whole as it is, along with the stalk. Okay, why? It is a good source of fiber. The stalk of green chili, it's a good source of fiber, and it's also the area where you will find a lot of lactobacilli. In green chilies, the stalk, okay, you will find a lot of lactobacilli. So when you are blending it, okay, for chutneys, or when you are using the whole stalk for cooking, in high temperature you will kill the bacteria, but if you are making chutneys out of it, the chutneys are at room temperature. Okay, so those are good. Clean the entire green chili properly, then you can use the stock. They're good sources of lactobacilli. Okay, alcohol, and drinking too much of alcohol can also disrupt the chemicals in your brain. Alcoholism can also lead to a lot of mental health issues. Some of the people with mental health issues may depend on alcohol to cope with it. So it is kind of a never ending loop. Okay. You may have a mental health disorder. To cope with it, you have started alcoholism, and it is making your case worse than before. Okay. So this alcoholism is kind of a loop uh, that snatches onto a problem and does not allow you to get your release from that problem, mental health problem. Okay, to deal with difficult emotions, difficult feelings. Okay, people use alcohol to escape from it. Okay, if you use alcohol this way, that will lead to addiction. Okay, addiction is a completely different topic. De-addiction is a completely different topic. Then food intolerances and allergies that can also impact you physically and mentally. Okay. For example, people who suffer from celiac disease, they can't have gluten. Okay. And majority of the good food, fine dine experiences and all, they use gluten. Okay, like pizza, burger, breads, okay, pastries. Okay, all these things require gluten. There are gluten-free options, but they are not as good as the taste factor of it. Okay, it is difficult to make the gluten-free options as healthy and as tasty and as indulgent like the gluten options. So that also impacts your mental health. Okay, you are going to a party, you are the only one who can't have certain food. Rest everyone is enjoying. So you may feel isolated. That can affect your mental health. Okay. Some medications that mental health medications that are being prescribed that can also interact with food. Okay. Certain foods might be dangerous for you if you are on certain medications, any antipsychotics and all, because of the side effects of the medication. Okay. You may also need to take some medication before and after you drink so that you can reduce your appetite to manage certain easy eating disorders. This can be prescribed. So before you are being prescribed, usually the psychiatrist or the doctor will explain you about the risk and side effects of this medication and what to eat, what not to eat when you are on certain medication. Okay. Write down how food is making you feel. Okay. Keep a food diary. If you feel able to write down of whatever you have eaten and how it makes you feel, okay, keep that notes. Okay, over time you can understand which when you are into your depressive stage, if there is a mental health patient, okay, they are undergoing a, a depressive cycle, they will know based on their food diary what they should eat, which can at least cheer them up. Okay, when they are in their happy state, what they should eat to bring down the energy. Usually, people who suffer from BPD, bipolar disorders, okay, bipolar disorders, they have the series of events of depression, okay, an event of maniac episode, okay. So, keeping a food diary, even if the patient themselves are not aware of it, at least the caretaker would know what type of food will work, what will not work, what food can make them feel worse or better, give them energy, okay, affect their sleep. For example, if a person is undergoing maniac episode, don't give them coffee at all. Okay, it's if it is a BPD patient and they are undergoing their maniac episode, no coffee, no tea, no caffeinated drinks at all. Okay, give them calming food, more fruits and vegetables, calming food, no spicy food. Okay, the opposite will work during the cycle of depression. Fermented pickles are also good, but not the Indian pickles that we spice up with a lot of oil and all, not that. Just the basic vegetables that you keep inside all the basic vegetables that you keep inside your vinegar or salt. Okay. So try to accept help from others whenever you are not feeling well. Okay. Uh, Others may offer to help you or try to offer help for others who are undergoing some mental health situation. Okay. If you are struggling and someone offers you help, you can suggest that help with some practical things. Okay, not just words of advice. Okay, if you know somebody who is undergoing depression, anxiety disorder, stress, eating disorder, okay, something like that, how can you help them? Help them with their shopping. Help them with placing cooking for them, placing food orders for them. Okay, placing water bottles near their desk or something so that they are hydrated. Okay, help them with practical things. Okay, you are going for shopping, so call them up and ask if they want something. You can help bringing something. Okay, plan, cook, and eat a meal together, so that can make the process less daunting. Because those who cook, they know being in the kitchen, putting something on the vessel is not just cooking. There is a prep time. You have to cut vegetables, you have to marinate certain food items. Okay, prepping time is there, cooking time is there, then cool down period, then serving. Okay, it's like that. Try to make the food preparation process easier. So it can take a lot of energy to prepare food and also to clean up afterwards. Okay, so just by thinking about this, if a person is undergoing a mental health scenario, just by thinking about what I have to cook, I don't know what to cook, what items I have, what I can make out of it. Okay, after cooking, who will clean? I will have a lot. Am I audible? Is my screen visible? Okay. So it can take a lot of energy to prepare food, even to think about preparing food and the cleaning up that happens afterwards. Okay. Especially if you are not well physically or mentally. This is a much difficult process. Okay. So wash up as you go. As you cook, these are certain habits. Okay. Don't keep the utensils in the wash basin, thinking that we will clean it later after making the food, after eating. You may too tired, you just want to rest. Okay, you may not have the energy to wash. So wash up as you go by preparing the food. This can help you feel less overwhelmed. Okay. If you're really struggling with washing up, okay, and it is stopping you from eating, that is what you have to do. Wash and then sit to eat. Okay. And try to get disposable plates in your kitchen or kitchen towels that are disposable for a short while, as long as you overcome your depressive scenario. Okay, depressive episode. Till then, use disposable plates so that there is no task of cleaning up afterwards. Okay. Always rinse your dishes before washing them. Okay, so that just to, even if you don't have the energy to wash right now, rinse it with water and keep it in the wash basin. Wash it later. Okay, whenever you have the energy or mood. Make all the food in one pot or search for one pot dishes in YouTube or in internet. Just search for one pot dishes. Okay, it's like khichdi or dum biryani and all. These are one pot dishes. You don't require extensive cooking vessels, more than two cooking vessels. Just one pot, one cooker is enough to prepare your meal. Okay. There are websites and books written on one pot meals, one tin recipes, and all. These are very useful for people undergoing mental health disorders. Okay. Use pre-chopped fruits and vegetables, frozen fruits and vegetables. That can reduce your prep time, cooking prep time. Okay. It's much more cheaper as well as compared to the fresh vegetables. Based on certain studies that we know, okay, we have seen that some traditional diets like Mediterranean diet, traditional Japanese diet, okay, they are much more beneficial to lower the risk of depression as compared to the typical Western diet. Western diet means burgers, bread based, large quantities, deep fried, processed. well, when we say Western diet, it usually points finger to USA. If you know what diet in USA is, okay, what is even the portion, the sheer amount of portion that they have, okay, quite high. Okay, so as compared to those Mediterranean diet, traditional Japanese diet is a lot of fluid based diet. Okay, lots of soup, teas, and all. Well hydrated diet. Okay, Mediterranean diet is rich in omega-3 fatty acids. Okay, lots of raw vegetables, green leafy vegetables, lean meat. Okay, olive oil, wine. Okay, these are the basis of Mediterranean diet. So these are much better options because they use traditional vegetables. They use unprocessed grain here in these diets. A lots of servings of fruits. Variety is there. If you see a Japanese table setup, okay, there are lot many small bowls that they will use, and every bowl will have a specific variety of food. A lot of variety is there. Okay, and also the portion size is modest. It's not that high and elaborate and big like a Western diet. Okay, and a modest amount of lean meat and dairy products. And they avoid a lot of processed food, refined food, sugars. Usually in Japanese and Korean diet, you will see a lot of fermented food options, okay, which are natural probiotics, and that's a daily routine for them. Eating fermented food is a daily routine for them. Okay. So that impacts their gut microbiome as well, keeping them healthy with low risk of cardiovascular diseases, depression, and other diseases, other lifestyle diseases. So that's about mental health nutrition. If you have